Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, 888-630-9625. That's 888-630-9625. That's how you find me. Love to talk to you on any subject that you have in mind. Perhaps you had a problem. You've tried, you've applied, you've done whatever you can think of to kind of, put it out. Well, guess what? Doesn't work the way you're doing it, so let me see if I can put a different light on the subject for you, different spin, so to speak, and make you think about it a little bit differently. Without drugs, without surgery. That's why we're here, to give you the most intimate and up-to-date information on integrative and alternative health methods. Got a lot of things to talk to you about today, and things that I think you're going to find extremely fascinating, provocative, as always, and to challenge you on any level that we can to kind of make you think a little differently and realize that your health is a do-it-yourself program. It's something that is in your control. You're the captain of the ship, so to speak, and you need to understand that. 2 years ago now, 2.5 years ago, I wrote Ageless Health. Health is a do-it-yourself program, and it was written for you as a manual, as a guide, as a way of really taking control, showing you how, step by step, not only the concepts, but the implementation of what to do about where you are right now. If you can go online, you can go to drtomroselle.com or you go to rosellecare.com and you can get a copy, or go to Amazon.com and you can find it in many different places. You can download it, you can put it on your iPad, you can do a lot of different things. So get a copy of it. We're excited. Why are we excited? Because in a very few short months, Ageless Health 2013, 3 Keys to Wellness, will be here. It's our annual event. It's our keynote. It's one that those of you who have been there before know that we change the data, the information every year. It is formidable. It's one that you're going to go away with more data, more information, more application than you can possibly think possible. This year we're going to be talking about unlocking your wellness potential and relief of headaches, migraines. We're going to be talking about skin, tongue, pulse, voice, diagnostic modes, autoimmune function, decreased risk of diabetes and heart disease and cancer, how to actually do that through nutritional protocols and so forth. And we're going to teach you how to calm your anxiety and eliminate the emotional pain that many of you go through, and so much more. That's just scratching the surface. Go online. You can register now. Go to rosellecare.com. That's rosellecare.com. It will be on all of our websites by the middle of this week, but right now you can register, and I would do it very quickly. Those of you who have been there, and those of you who have been VIP participants in the years know those seats go very quickly. They're usually gone within the first 2-3 weeks that we make them available. They are available now, and you can register. We'll let you know whether or not you're able to get in, because, as I said, they fill up very, very rapidly. So what do you get for these different levels? The VIP level is very limited seating. You're up front with me, first row. You're at the table. You get a copy of the Ageless Health book or audio, whichever one that you would like to have. You're going to have lunch with me and my guest, Ann Abernathy, who's going to be one of our presenters this year. You're going to get Best of Dr. Tom Roselle Live CD. You're going to get a 20-minute time management consultation with me. I'm going to sit down with you. I'm going to show you how to put this all together. And we'll give you a bottle of water, and we're going to give you a 30-minute massage at the Roselle Center for Healing. We're going to give you all the lecture notes and materials, and in this huge event bag that is massive, and that's the first seating. We want to talk to you about the priority seating, and that's you get the second, third rows right up front, so you can be close and intimate with us. You're going to get a 20-minute time management consultation with one of my doctors, and they're going to sit and show you how to put this together. You're going to get organic lunch. You're going to get the best of Dr. Tom Roselle CD. You're going to get a gift bag. You can get all the lecture materials. And general seating is going to give you all the materials and organic lunch. You're going to be with us. You're going to be intimate with us. We're going to show you how to apply this stuff. Get online. Do it today. RoselleCare.com. That's RoselleCare.com. Don't wait, because, as you know, we fill up very quickly every year, and once it's there, and it's done, and I promise you, this will be an event that you have absolutely no idea how much you're going to walk away with, how much you're going to learn. We'll have vendors. We'll be talking to you. My entire staff will be there. It is designed for you. My team's there, and we're going to be talking about everything that you possibly can imagine relative to your health and your wellness, the optimal achievement of health and wellness. That's our mission. We're here to serve you. We're here to educate you, and we're here to empower you to take control of your health on a day-to-day basis. Several things I want to talk to you about today. Some very interesting stuff, and we're going to touch the bases on a couple others. It depends on how much time we have, but some things that are anti-cancer activities and some things that will actually prevent you from dying of cardiovascular disease and decrease your risk by about 80%. What's that? Wow. I mean, wouldn't you like to know about that? Well, why don't we talk about that first? In the meantime, 888-630-9625, 888-630-9625. Love to talk to you. We can call this the forgotten longevity product. We can call this, the thing that's been put in the shelves and nobody's talked about product. We can do a lot of different things with it. But anyway, there's a lot of stuff out there right now as far as life expectancy, and it's kind of one area of the world to the other to kind of flex its muscle and says, we live longer than anybody else. But the truth of it is, in Okinawa, Japan's famous island of longevity, it has the highest percentage overall of people living over 100 years, and we're getting more and more and more. There's many, many factors, obviously, that come into play with longevity, environment and emotional stress and diet and so forth, and just kind of all kinds of things. We know today there's an area called epigenetics, and that means that your gene structure is being influenced by the environment, and our environment is very, very powerful. But also, there are certain types of amino acids that, if they are abundant enough, that they seem to make a huge difference in what happens. And this particular little guy we're going to talk about has a real significant impact on heart, cardiovascular health, insulin sensitivity, electrolyte balance in the body, hearing function, wow, and immune modulation, and it goes on and on and on and on. So, but here's the piece, and this is what I was teasing you with earlier on. Reduction of mortality by nearly 80%. And what we're talking about is this amino acid protects against heart failure. How does it do that? We're going to talk about it. And what is it? What am I talking about? We're talking about something called taurine, Taurine. Taurine I've been using in the practice for a lot of years. It's part of our Basic 6 protocol, and something that I didn't invent but stole from another brilliant doctor, a guy by the name of Dr. Alan Vinitsky. And he came up with this protocol, and we've been using it and testing it and going through his paradigms and protocols, and find that it's extremely beneficial. But taurine has a huge effect on many different systems, neurological pathways, brain pathways, but it's one that has a huge, huge, huge impact on hearts. There's a lot of studies that have been out there, and a study going back about a year ago, November 2012, it made a huge statement about taurine, and it was kind of got my attention. It says, considering its broad distribution, its many cytoprotective attributes, and its functional significance in cell development, nutritional, and survival, taurine is undoubtedly one of the most essential substances in the body. And, although it's possible, your body does produce taurine on its own. It's not one of those guys that you have to get outside the body. You still need to get taurine from other sources because it seems to get burned up very, very, very quickly. So we want to talk about this guy. Taurine is huge, and it does all kinds of stuff. It increases glucose metabolism, and it helps you assimilate and burn fat, and it really goes on. Huge benefits with taurine. First of all, it is the most abundant amino acid that, most of us didn't even know that existed until I just told you about it a few seconds ago. And, it gets into the body and it excites cells, and it gets the nerves moving the way it's supposed to, but particularly in the heart. And there's a lot of strong studies in immune function that suggest that taurine in higher amounts can protect us against many different things, increasing even T-cell formation. Supplementation with taurine can prevent diabetes and helps the body become less fat, because we know that when blood sugar levels are too high and can't be utilized, the body tries to protect you by doing what? It stores fat. It builds fat up. And the most destructive fat is the one that builds up around organ systems, and that's deadly. And also it gets into the cardiovascular system, and it begins to clog your arteries and cause tremendous amount of damage. That's what happens. It's one of these guys that stops that. Taurine protects the eyes. It protects the ears, and it does it, and we're going to talk about how it does that, because this little guy, if it doesn't get your attention, nothing is ever going to get your attention. And it's in different types of foods, and obviously I want you to understand that food, good food, not GMO food, organic food, is the way that you do most of everything. And we'll give you some milligram dosages that seem to work, but I don't want you just to go out and buy taurine and think it's a cure-all, because remember I said it's part of a basic 6 that we use with our patients for very, very specific situations. In taurine, what you're going to find out, even in trained athletes, taurine increases muscle contraction and viability. But it does it, as we said, not only in skeletal muscle, but also in heart muscle. So we know that the heart is going to be stronger. It's going to work better. That's why it prevents heart failure. Taurine helps the body get rid of something called lactic acid, which is kind of a byproduct. And that's what makes you feel sore and painful after you've worked out, particularly if you haven't done it for a while. But it cleans up the lactic acid, and so you don't have that problem. It makes things, happen much more easily. It protects DNA. It protects the oxidative damage that we're exposed to on a regular basis because of all the garbage that we eat and all the things that we do to ourselves. So this little amino acid, taurine, is extremely, extremely beneficial. And the supplementation levels start in the studies that I've noted anywhere from 1,000 grams a day up to 1.5 to 2,000 grams a day to get the effects that we're talking about. And the study that we talked about that came out last November basically said that if you take this taurine for just 14 days, it can reverse diabetes and induced abnormalities in the arteries, meaning it begins to soften and make more flexible the arterial patterns, so you can get increased flow, blood pressure goes down, and you see some amazing effects because of this. So yeah, we use taurine as part of a package of different things because of its profound effect, not only in neurological flow, but in cardiac advancement and shunting oxygen to the body. And also a very interesting thing, it also will help prevent kidney damage. Amazing supplement. We're going to get more into that. We're going to talk about where you can get taurine in your food, because that's probably the most important thing as far as I'm concerned. You'll be surprised because some of you who are vegetarian, can't get it as easily as other people. So we're going to have to tell you, listen, this is the fact of life. This is where you're going to get it. Meanwhile, I'd like to talk about you and your problems. 888-630-9625. That's 888-630-9625. And we're going to be coming up to a break, and we're going to be talking about some of the people that make Dr. Tom Roselle Live possible and bring you this information every Sunday at 12 noon. Next Sunday, I'm going to be broadcasting to you live from Los Angeles at a tremendous conference that happens once a year, and we're going to talk to you about some of the most elite docs in the world are going to be there. I'll give you that information a little bit later. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625. 888-630-9625. Love to talk to you on any subject that you have in mind. We're talking about different things, but recently, like a few minutes ago, we were talking about taurine, amazing amino acid, one that is all around us, but we don't get enough of it. And particularly if you're vegan, you're definitely not getting enough of it. Where's it found? It's found in seafood and meat. And if you don't do those two things or get enough of them, you're not going to assimilate it. And if you're only getting, small amounts occasionally, you're not going to get enough of it. Several studies were showing that, diets were determined to be around 58 milligrams of taurine, even those people who are eating meats. And those who are eating a lot of meat, some are getting about 200 milligrams a day. Not a lot. It's in the ranges like from 9 to 370. So you need a whole lot more than that. I mean, to turn any of these things around that we're talking about 1,500 to 3,000 milligrams per day. You really got to step it up. But taurine is one of those things that we use, and you need to do your own research. Take a look. It's out there. It prevents eye disease. It reverses tinnitus. We're going to begin to actually do some experimentation in our practice with it, and this is quite a safe product. But if you have any questions whatsoever, you can go to drtomroselle.com. That's DRTOMROSELLE. I'll be more than happy to get back to you and answer your questions on this or anything else. Let's go to the phones. Janine, how can I help you?
Hi, good morning. This is a question about vitamin D3.
Yes, ma'am.
Which is a better one to take? Would it be the animal-based, the fish oil vitamin D3 versus the vegetable or vegetarian vegan-based vitamin D3? And I do know that the liquid would be absorbed more quickly if you can get it.
Perhaps.
Which would be the better?
Perhaps. We use all of them. We use all of them. And there is no better. It better depends on you. If we have a patient who is vegan, then obviously we're not going to give them animal-based anything. If the patient has a problem with oils, we're not going to give them something that's suspended in oils because the gallbladder, the pancreas can't deal with it adequately. So you have to first you make sure it's an organic form, no matter what you're doing and what form you're trying to take in. You have to make sure that you have your gallbladder. If you don't have a gallbladder, and I'm saying this generally, not just you, but anybody, then I would not encourage you to take a oil-based form of any kind of supplementation because you're going to have a hard time with it. There are some products, like from Standard Process Laboratories, where the levels of vitamin D are much lower. They're 1,000 units. They're combined with some A. They have a tendency to get into the body. They're professional labs. You can't get them on your own, but if your doctor has them, then you use that, and you have to chew these products. They're assimilated much faster that way. So I'm not hedging your question. I'm just telling you that it really is dependent on other people. Some of these are soy suspensions, some of them are other types of oil suspensions, so you have to look at them. But I would start with an organic form, and then based on what your dietary habits are, what you know about yourself from a medical point of view, surgeries and so forth, and then you go from there. I hope I didn't confuse you too much.
No, you didn't. I didn't realize it was a chewable kind. I thought the liquid was absorbed the most quickly.
No.
Perhaps vegan is not liquid form.
No, there's difference. You can go out there. I mean, if it's a soy suspension, it can be a vegan form, but you have to look at the bottle. If you go into a health food store to buy them, make sure it's a good one and ask them, listen, I have a gallbladder problem, or I bloat up after I eat oils. Do you have another form? And they should be able to direct you. With our patients, as I said, we have 4 different types of vitamin E or vitamin D that we use in our office, and it's specifically because of the things that we just talked about. So if I can help you further, let me know. I appreciate your phone call. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We've got several today that I'd like to follow up with and just let you know about what's really happening out there. Interesting article that I read recently, and it kind of said, see, I told you so, and it was about docs, and particularly allopathic physicians, MD types. And I'm kind of picking at them, but I'm also not picking at them. And the problem is that physicians often are the worst patients in the world. And they're more overweight than anybody else. They have more problems in chronic health conditions. They suffer more from things like congestive heart failure and hypertension than anybody else. And even medical employees, they spend 9% more on medical expenses and prescription drugs than anybody else. And they're 5% more likely to be hospitalized for conditions. Now, my question to you is simply this. If they can't take care of themselves, do you think they're really going to be able to take care of you very well? I would think about that, and I would go to what I've said to you always. Your health is in your hands. Do the research. Listen to me. Don't believe anybody, even me, and do your own homework. I'm here to provoke you. I'm here to get your head out of the darkness and where it needs to be in the light, and that means in your hands, in your direction. Don't go away. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. 888-630-9625. Love to talk to you on any subject you have in mind. Give me a call. Let's chat about it. Let's figure out if we're going to put you in a different direction and tell you whether you're doing something that is supportive or maybe not so much, and it's getting you into more trouble than you would otherwise. There's so many of you who go around and are in pain and are suffering the slings and arrows of some of the choices that you've made over a period of years, and then you go in your doc and he puts you on drugs that make things a whole lot worse, and your body begins to break down, and you wonder where things are coming from. And I thought that doc was supposed to help me, but well, maybe not so much. You're going to get a chance this fall, October the 19th, Saturday. It's going to be an all-day event. It's our keynote event. It's Ageless Health 2013. Please join us. I promise you, you will renew your health. You will have an experience and receive the tools and the capacity to turn your life around. It's an amazing day. Ageless Health 2013, the 3 keys to wellness. And we have multiple levels of participation. You need to do it now. The VIPs go very quickly. For right now, for today, for this moment, to register, you need to go into rosellecare.com, ROSELLECARE.com. Later on this week, you'll be able to go into agelesshealth2013.com. But for right now, rosellecare.com, and it's all there. Click, boom, as soon as you walk in. And there's a video that's about last year's event, and you're going to be able to see and really feel what it is that you're going to get yourself involved in. I promise you an extraordinary day, one that you'll never forget. I promise, above and everything else, of any expectation, this is a day. Please join us. I'd love to have you there. Anti-cancer therapy, anti-cancer activity. What's that all about? Well, guess that's what we're all afraid of dying of, right? Cancer. I mean, it ravages our body, it eats us up, it destroys our systems, and is there a way out? Well, I've had the opportunity of meeting several people over my years in practice that, on their own volition, they're the ones that have turned their lives around themselves without any kind of medical intervention. How's that possible? It's like the guy that goes in the doctor's office, and he's a very high-powered guy, and he is doing well with his life, and he's playing sports all the time, but he's top executive, and he needs to have Keyman insurance, and he's doing a $2 million policy, so they do all kinds of blood tests, and Doc says, I'll give you a call when it all comes back. Doc calls him, and he says, Mr. Jones, I'm really sorry to tell you this, but you're HIV positive. And the guy just looks at him, and he says, how can that be possible? And in his brain, it's a death sentence. 6 months later, with no reason whatsoever, the man dies. So that's the emotional piece. But there are other pieces to health, and that can be applied differently. There's a woman by the name Cathy Buckley, who many of you have heard me talk about. And Cathy is an amazing lady, and she was diagnosed with stage 4 metastatic cancer at one point, and they told her she had less than 6 months to live. And at that moment in time, she made a decision. She said, I don't think so. Who are you to tell me that I'm going to die? And what she did is she changed not only her attitude, but she changed a couple of things we're going to talk to you about now, which are very important that you understand. The benefits of exercise are huge, and they're very far-reaching. From physical fitness and cognitive function to just the psychological, emotional pieces of it. You can't oversell this stuff. Even the old nutritionists, Adele Davis, Carlton Fredericks, Linda Clark, and so forth, and I can list tons of them, they told you in their writings that if you're going to cheat on something, cheat on your diet occasionally, never cheat on your exercise. It's hard to put this piece of it aside. Researchers have shown time and time again that regular exercise is a lifesaver. I mean, I've told you that if you get out and did nothing else but walk 2 miles every day, just 2 miles, you decrease your risk of dying from any sort of disease process by 50%. That's huge. That's just 2 miles. That's going out, listening to your headset, and getting your day started. And 50%. Do you know what not only the quality of your life, but the financial cost savings you are? That's amazing. In a pilot study that was led by the University of Nebraska Medical Center, they went and they did a study with this Rehabilitation Institute, and they found some amazing things, that regular exercise dramatically increased the patient's immune systems after they went through chemotherapeutics. So they're going through chemotherapy for cancer, and they found that just exercising, not on a very hard level, but it increased their immune response to help fight. This study was done with cancer survivors that were undergoing chemotherapeutics, and they did it over 12 weeks. So it wasn't a really long study, and it included some type of low-level aerobic training, some light weights 3 times a week, and they found that the T cells, these anti-cancer, antiviral substances in our body, saw significant improvements post-exercise than compared to what they were prior to that. This study goes on to, really support so many other things that have been out there for a long, long time. James, thank you for calling. How can I help you, sir?
Good afternoon. I'm afraid I came in on the end of the question.
That's okay.
Where you were talking to the caller who had the gallbladder removed, and you were talking about oil-based pills. I had my gallbladder removed about 22 years ago. Seemed to have no side effects except occasionally I burp. My internist had suggested I take fish oil on a regular basis, and I was wondering, is that something I should be taking or not taking?
My suggestion to you is that you need the omega-3 fatty acids, but there are other ways of getting them. Go to a good health food store, and they have them in a food-based form. You want an organic form. Here, the reason is this. When you have gallbladder surgery, the gallbladder itself is a catch basin. That's all it is. The tubes that come from the liver that go to the gallbladder are producing your bile. And what the gallbladder is supposed to do, in conjunction with the pancreas, is when you have a fatty food substance that comes down into the small intestine from the stomach, they're supposed to squeeze their substances, and they break up the fat so your body can handle it, so it can digest it, and so you don't get this bloating and so forth. If the gallbladder is no longer there, you don't have the amount of bile that you need anymore to go after the fats. So if you get high fatty substances in your body, it's more difficult for you to break them down, number one, and you get a kind of sometimes a little sick or bilious feeling. Anybody that has had gallbladder surgery has to take gallbladder support type of enzymes the rest of their life. It's
I
not.
do?
Yes,
I've never been told that.
Because your physicians don't get it. They're not nutritionists. They don't understand normal biochemical function when it comes to nutritional protocols. That's just the unfortunate part of their educational training or lack thereof. Not all physicians, and there are some really great guys out there that are functional medicine allopathic physicians that really understand that and they get it. But the truth of it is that when you have a fatty substance like that and you can't break it down, your body's going to have to store it, or it's going to coat the intestinal system, and you end up with fatty liver problems. You end up with fatty colon, and you stop the absorption of many other things. So yes, unfortunately, that's the case. You need to really talk to somebody who knows nutritional protocols well. I don't know your history well enough to make a recommendation to you. I don't know what your other blood work looks like, but I can tell you that without a gallbladder, you cannot break up fats. So if you just want to get a good omega-3, then go to a good health food store. Talk to them and say, listen, I don't have a gallbladder. I need to have something that's non-oil based. They're there. You can get them, or you go to a nutritionist, or come to an office like ours, where we have a full nutrition department, and they can evaluate you and tell you what you need, not only dietarily but also supplementally. I hope that helps. James, if I can help you, you can get a hold of me at drtomroselle.com, and I'll go back and forth with you on a more specific basis. Thank you for calling. I really appreciate your phone call. 888-630-9625, 888-630-9625. Think about it. When you have your gallbladder removed, God didn't put that gallbladder there just because he wanted to fill up a space. It's there for a reason. And when you start removing parts, you start removing the functional capacity of what those parts are supposed to do. So you end up with more fatty acid problems in the body. You can't absorb things the way you're supposed to. You're going to hinder different types of transmission if you can't get the fats in. But you can get them from other forms. It's just the oils are more difficult for the body to break down and handle, so you end up with side effects because of that. But yes, as I said to our last caller, if you've had your gallbladder removed, you need to have supplemental products the rest of your life with your meals. It's just the way it is, because now you don't have a place to catch the bile. The gallbladder's gone. So it continues to be produced. It goes directly into the intestinal tract. And so you're getting some of it all the time, but you're not getting enough of it stored, so when you need it, that gallbladder can squeeze its contents into the intestinal tract and go after the food. One of those things. 888-630-9625. Love to help on any product, any problem, any thought process. That's why we're here. That's why you can get me here, or you can get me off air at drtomroselle.com, drtomroselle. Attending a conference next week that I'm really excited to go to. It's the International College of Applied Kinesiology annual meeting. It's going to be held in Los Angeles, and these are brilliant doctors, interprofessional disciplines from all over the world, chiropractors, medical physicians, dentists, and so forth. This is the elite of the elite, and it's a group that I've been affiliated almost the entirety of my career. It's one that has spurred me onto many different areas of investigation and thought process. It's a great group. And as rumor has it, that I may be taking over the helm of the International College of Applied Kinesiology for the next couple years. Big responsibility, but, somebody's got to do it, I guess, right? Lee, Silver Spring, how can I help you, sir?
Yes, excuse me. Last year you talked about peanuts exacerbating some kind of I have a fungus infection on part of my body, and you said that it makes that worse. Now I'm wondering if that includes all kinds of nuts.
No, just peanuts. Peanuts. peanuts by themselves are not a nut. Think about it. They grow underground. Nuts grow on trees,
Yes.
right? Okay, so a peanut is a rhizoid. It's actual fungus. And so when you take it into your body, you've got not only the rhizoid itself, but you also have anything else that was in the ground, that was moldy, that was damp, and so forth. So if you
I love peanut butter.
Yeah, well, you're going to have to switch to almonds and almond butter.
Okay.
Because peanuts are not your friend right now. It's not a good thing.
Tree nuts are all right then.
Tree depends on what's your blood type, Lee. Do you know if it's an O?
Oh, I don't remember.
Okay. So there are certain nuts that work better with certain people, but make sure you do this. Organic nuts only, and don't eat mixed nuts.
And don't eat what?
Mixed nuts.
Mixed nuts, yeah.
Okay? So organic nuts, and limit the amount of nuts that you eat to no more than a quarter of a cup a day.
Yes, I've noticed some improvement in the condition that I have since I stopped eating those, and I haven't eaten one nut since then that I know of.
Yeah, you can don't touch the peanuts, the peanut butter, the peanut oil, any of those things. If I can help you, Lee, give me a call. I'd love to do that for you. We have a couple other people online. I'm going to try to get to you. However, we're coming up to a break, and I'm not going to have enough time to talk to you and do the break too. So we'll come back to you right after the break. It's a very active program today. I'm here to always help you as much as I possibly can. The insights, the kind of things that I know about that I can share with you, that's why we do what we do. Don't forget, we're going to be in L.A. next week, and we're going to be live from L.A., so you can talk to us there as well, but you can talk to us off the air at drtomroselle.com. Be right back.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live at 888-630-9625 every Sunday at 12 noon. Our phone lines are still lit up, and there's several things I want to talk to you about, and I've only got 3 minutes and a couple seconds, so I'm going to try to do this really quickly. Leslie, let's make it quick. How can I help you?
Will do. Okay, so I've had strep throat on and off regularly, I think more unusual than most, since I was a kid, and I've recently discovered that I have tonsil stones, which seem to be masking the symptoms of strep.
They're called Cialis. Go ahead.
Yeah, so I'm wondering, I'm seriously considering requesting my tonsils be taken out. And I know that there's been back and forth about whether they're good for you or not. What's your take on that?
No, you don't want to get your tonsils removed. It's one of the most protective mechanisms that you have in your body. You can clear those out. There's ways of doing that. We deal with patients all the time. You want to get your body to start purging. You want to get that lymph system to open up. You want it to start draining. That's possible. It's not going to be done with antibiotics. It actually suppresses it, and that's what part of it is over a period of time, the body tries to wall things off, and it hardens them and it entraps them, and your tonsils get these little crustaceans in them. But that can be released, but you're going to have to be a saint. There's a lot of things to do. Get a hold of me at drtomroselle.com, and I will take you through it. But the short answer is don't have your tonsils removed, and I'll tell you what else you need to do, okay?
Thank you.
You're welcome. Greg, how can I help you, sir?
Doctor, what's the success rate with people with red rice yeast? I hear it's been very good with lowering cholesterol.
It is. So let me go real quickly, Greg, because we're coming up to the end of the program.
Sure.
Red rice yeast is a statin. It's just a natural statin. And it has a lesser impact in the body. But if you're going to take it, you still have to take it with coenzyme Q10, which is one of the things that any statin depletes within the body. Not a great thing to have in your system. So Now, having said that, let me say this to you. Cholesterol isn't why we have heart disease. It's inflammatory reactions within the body. You can have a low cholesterol level and still get cardiovascular disease and plaquing because the fat in your body is trying to protect the arteries from burning up because of the oxidative stress reaction due to the inflammation. So when somebody has, a cholesterol at 230, it doesn't mean that you have a problem, but every physician in the world wants to either put you on aspirin or a combination aspirin and statins and so forth to get it down. But if you're going to take a red rice yeast product, it's something that's been used in China for forever, and it's a good product if you can get it in organic form. The FDA is going to tell you, well, the studies aren't in and it can't be regulated. Well, that's a lot of poppycock. But if you want to bring it down, you can use it. It's not as harmful, but make sure you're taking coenzyme Q10 as well, CoQ10, and you want to take about at least 50 milligrams a day. Greg, I hope that helps. I'm coming up to the end of the program. I wish I could get more in depth because there's a lot more that I could talk to you about that. I've still left a couple of you online. I am really sorry. Give me a call at the office or drtomroselle.com. Actually, that's the best way of finding me because I do answer all of my emails personally. It may take me a couple of days, but I do get to you. I'll talk to you next week from Los Angeles, and my guest will be Dr. Leonard Poe. We're going to be talking about thyroid problems, and I think you'll find that interesting. If we have the opportunity, I'll have one of the docs from the conference internationally speak to you as well. See you next week. Dr. Tom Roselle here.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.